guys? Welcome back. Today's video is going to be about calcium supplementation for bone health. So before we get into how much or what kind, I just want to clarify a couple of things that tend to really trip people up. And the first one is that the amount of dietary calcium that's recommended is a total amount, and that includes the calcium from your diet as well as calcium from supplements. And we'll talk about that a little bit more later, but also it refers to the elemental calcium that's in the calcium salt or the calcium compound that you're taking. And that can be really confusing because labels sometimes will label elemental calcium and sometimes they won't. And each salt has a different percentage of elemental calcium. The one that has the most elemental calcium is calcium carbonate. And I'm gonna go through one of these labels with you. Calcium carbonate contains 40% elemental calcium, which means that if you have 1,000 milligrams of calcium carbonate, 40% of that is 400 milligrams. So your supplement actually contains 400 milligrams of elemental calcium. So if you're trying to get in 1,200 milligrams total of elemental calcium, you need to take 3 of those tablets to equal 1,200 milligrams. Now, hopefully you're not getting all of your calcium through your calcium supplement. You're getting a lot through diet, but that's kind of at least theoretically how it would work. So I'm going to show you with a real product here. This is just, like a generic Tums. It's just an antacid. Some people do use this for calcium supplementation separately from as an antacid. So if you look at the label at the top, it's saying for antacid use, it's giving you the name of the type of calcium, which is calcium carbonate, and it says it's 1,000 milligrams, and the serving size is 1 tablet. But if you look down at the bottom, it tells you if you're doing it for calcium supplementation. Now here, it tells you calcium 800 milligrams, and the serving size is 2 tablets. So you can see how that would be really confusing, because if you're looking up here and you're saying, okay, each tablet contains 1,000 milligrams of calcium carbonate, so 2 tablets must contain 2,000 milligrams, but that's not the case when we're talking about elemental calcium, which is what it's listed as down here. Very confusing, but nonetheless, hopefully this helps clear that up a little bit. The second part that can be confusing, and we kind of touched on this just now, is making sure that you're looking at the serving size, because the amount that's listed, you definitely want to know if it's 1 tablet, 2 tablets, things like that. So just make sure that you're clarifying that and looking at the serving size. And then the third part of it is, if you're looking at the percent daily value of calcium and it's giving you a percentage there, just know that that percent is based on a daily calcium intake of 1,000 milligrams. That might be what you need. It might not. So just because, labels are kind of generalized, so they are based on a 1,000 milligram per day calcium diet. So back to this one, as you remember, that said 80% of the daily value of total calcium is contained in 2 tablets, which was the serving size here, is 800 milligrams. So 80% of 1,000, 800. And that's the elemental calcium in this product, but they'll all be a little bit different. I have another product here. This is just kind of a over-the-counter women's 1-a-day vitamin. And this one actually was really nice because here they tell you, I don't know if you can see this very well, calcium, and then in parentheses they say elemental. So nice. 500 milligrams, 50% of the daily value. Again, 50% of 1,000 is 500, so that's perfect. And then make sure that you're looking at the serving size, so 1 tablet. So in 1 tablet here, you're getting 500 milligrams of calcium, of elemental calcium. That's half of what you need if you're needing 1,000 milligrams per day. So just to clarify all that again, I'll kind of sum that up. Make sure that you understand that the recommendations that we give out and that you'll hear a little bit later here are for total amount of calcium that you need in your diet. And that's divided between diet and supplements, and it's in elemental calcium. So different calcium salts have different percentages of elemental calcium. And so that will either be listed on your label as specifically as elemental calcium or just as the total amount of calcium salt. And then you have to do the math. Or you can look at the percent daily value based on a 1,000 milligram calcium diet. Or you can ask your doctor. Well, now that that is perfectly clear, I want to get into how much calcium that you need. And basically the amount of calcium that's recommended per day really does depend on where you are in the lifespan and if you're male or female. These recommendations that I'm going to give out are for folks who are generally healthy. If you have a malabsorption condition, or if you've had a, for example, a history of gastric bypass or things like that, that can reduce your body's ability to absorb calcium, or any kind of other malabsorption conditions, then these may not apply to you. You might, in those cases, you may want to ask your physician to give you more specific recommendations because you may need a higher amount of dietary calcium. But for the general rule, adolescents, age 9 to 18 years, do need more calcium than we do at other times. And so we do recommend that teenagers get about 1,300 milligrams of total calcium in their diet. For women age 19 to 50 and men age 19 to 69, we recommend 1,000 milligrams of calcium per day. And that's just at that point, kind of that's the time in life when our skeleton's kind of at a steady state for the most part. After menopause, so about 50 and up, 51 and up, the Institute of Medicine recommends that women get 1,200 milligrams of calcium per day, and men who are 70 years and older also get 1,200 milligrams of calcium per day. And again, very important point, these are amounts of total calcium. The best way to get calcium is through your diet. Supplements really should only be used as an adjunct if your diet's not sufficient. The safest way and best way is always to get it through your diet. So foods that are high in calcium are going to be dairy. So, you know, people who are lactose intolerant, those are the folks that may need to do calcium supplements. In any case, if you can get it through diet, that would be the best. So we're talking about, now eggs are not considered dairy. I have a lot of patients who get confused about that because they're kind of in the dairy section right next to the milk, but they are not going to be a high calcium source food. We're talking more about milk, yogurt, cheese, ice cream, that kind of thing. Important to note that if you have a reduced fat version of any of those things, it doesn't affect how much calcium's in it. You know, I know a lot of people are worried about their weight and want to kind of like reduce the amount of calories that they're taking in. So if you take skim milk versus, you know, whole milk, the skim milk is going to have just as much calcium as whole milk or 2% milk or 1% milk. So if it's best for you to have a lower fat dairy product, that's totally fine. But if you're aiming for a 1,200 milligram diet, if you get in 3 servings of dairy per day, you're likely getting enough enough calcium just through your diet, and you probably don't need to add a supplement. If you're somebody who can't quite get that much in, then you may need to add a little bit extra. So, you know, if you're getting 2 servings of dairy per day, you may want to add a 500 or 600 milligram calcium supplement to try to just help to get up to that 1,000 or 1,200 milligrams, wherever you need. The other important thing to note is that our body is not really capable of absorbing all 1,000 or 1,200 milligrams all at once. We kind of max out at about 500 milligrams of calcium at a time that we can physically absorb at once. So that's why calcium supplements need to be kind of staggered or dispersed throughout the day and at different times. And so now for the $1,000,000 question, what type of calcium should I be taking? So like I mentioned before, there are a lot of different types of calcium salts out there. The first one I'm going to talk to you guys about is calcium carbonate. It is, the advantage of calcium carbonate is that it has the most elemental calcium percentage-wise out there of all the different calcium salts. So it's very nice because you don't have to take like a gazillion tablets. Also, it's pretty cheap. It's readily available. So it's commonly prescribed, and honestly, it's what I recommend for most of my patients. It is, you know, in nature or in the world, calcium carbonate is present in dolomite, oyster shell, coral, pearls, and marble. But I just want to caution you guys about the use of, you know, things like oyster shell, calcium, and things like that. You just want to be careful about if you're selecting an unrefined calcium product, because they may contain lead. This is something that's been found before, or other kind of toxic metals. So any of the unrefined calcium products, I would just kind of be cautious about. But otherwise, calcium carbonate, especially like in the form of just, you know, some over-the-counter Tums or something like that, usually works just fine. Second, calcium citrate. So calcium citrate contains only 21% of elemental calcium, compared to that 40% of elemental calcium with calcium carbonate. And so you have to take essentially kind of like twice as many tablets to get the same amount of calcium if you're using calcium citrate compared to as if you were using calcium carbonate. So like, why should we use it? You know, like it's kind of a pain in the neck to take a bunch of tablets. Well, calcium citrate and calcium carbonate, when taken with meals, are actually absorbed about the same. But outside of meals, if you need something to absorb a little bit better, then calcium citrate may be a little bit more bioavailable than calcium carbonate. So for those folks who may have a hard time for one reason or another to absorbing calcium, then calcium citrate may help a little bit in absorbing it a little better. There's another one called calcium citrate malate, which sounds really similar, and they are very similar, but there is a little bit of a difference in that calcium citrate malate is complexed with malic acid, and that actually helps make it a little bit more bioavailable. So if you're on like a medication that reduces gastric acid secretion, like a proton pump inhibitor, such as esomeprazole, omeprazole, or pantoprazole. These are things that can reduce your body's ability to absorb calcium. And the reason for that is that calcium carbonate does require an acidic environment for it to dissolve and be absorbed. So calcium citrate malate doesn't actually need to have an acidic environment. It doesn't need gastric acid because it is complex with the malic acid. So it's more bioavailable. And unlike calcium citrate, as far as increasing the bioavailability, you can take it with a meal or without a meal. So that's kind of nice. The downside about calcium citrate malate is sometimes it can be a little bit more expensive than calcium carbonate. The next one I'm going to talk about is calcium phosphate. That one is pretty high in percentage of elemental calcium, 39%. Its sources in nature are in bone, ivory, and antlers. You'll see kind of like bone meal products and things like that, which are basically like crushed bone that are sold sometimes. And again, these ones I would just kind of caution you guys about, just because if they're not purified, then they may have some, you know, toxic agents in them and things like that that can be harmful. So just be careful about that. So to sum it up, try to eat a healthy diet with somewhere between 1,000 and 1,300 milligrams of calcium per day, depending on where you are in your life, if you're male or female, and how old you are. If you need to supplement because you can't get enough through your diet, calcium carbonate is a great choice. If you have low gastric acid production or other kind of malabsorption conditions that make it hard for you to absorb calcium, then calcium citrate or calcium citrate malate would be good options. Definitely take caution when you're using non-purified supplements that have a hodgepodge of other ingredients, and since they can also affect your health in other ways like we talked about. In general, I kind of tend to recommend that people steer clear of those type of things. Well, I hope this video was helpful. If it was, click like below. That helps me to get this information out to more people, and subscribe. I'm Dr. V, endocrinologist, helping you with all your hormone questions and to find your perfect balance. Don't forget to leave your comments below and any questions or topics that you might want me to cover in future videos. Until then, hasta luego.